Hello everyone, I am Dr. Deepa. Today we will learn about the topic larynx in the head and neck. The larynx is essentially the important organ of the phonation and the respiration. This larynx is the upper expanded part of the lower respiratory tract which is modified in producing the voice. Hence, this larynx is also called as the voice box or the organ of phonation. The larynx protects the lower respiratory passages and it acts as the watchdog to prevent the entry of any material other than the air. So, when we talk about the location of the larynx is located opposite to the third cervical vertebrae to the sixth cervical vertebrae in case of adults. In case of children, the location extends from C1 to C4, a bit higher than that of the adults. When we need to know about the extent of the larynx extends from the upper border of the epiglottis. Yes, the extension of the larynx is from the upper border of the epiglottis till it reaches the lower border of the cartilage, that is the cricoid cartilage. I repeat, the extension of the larynx is from the upper border of the epiglottis to the lower border of the cricoid cartilage. The larynx is roughly around 45 mm in its vertical length. Transversely, the measurement is around 43 to 45 mm, whereas the anterior-posterior dimension is around 35 mm in case of adults. The entire larynx, that is the framework of the larynx, is essentially made up of the cartilages, the muscles, the membranes and the ligaments. The larynx, as I have told just now, is composed of the cartilages, the ligaments, the muscles and the membranes. When we talk about the cartilages of the cartilages mainly make up the skeletal framework of the larynx. The cartilages are in total 9 in number. Yes, there are in total about 9 cartilages which make up the larynx. These 9 cartilages are divided into the paired and the unpaired cartilages. They are divided into the paired cartilages and the unpaired cartilages. The paired cartilages are 3, whereas the unpaired cartilages are also 3 in number. So, the unpaired cartilages are mainly the thyroid cartilage, number 1, the epiglottis, and the cricoid cartilage. The cricoid cartilage. These are the unpaired cartilages. The paired cartilage include the arytenoid cartilage, the corniculate and the cuneiform cartilage. The corniculate and the cuneiform cartilage. So these are the paired cartilage which are present on both the right and the left side. So the unpaired are 3 in number, whereas the paired are 6. So in total the cartilages are about 9 in number. We will look for the cartilages one by one. Later, we'll move on to the ligaments, the muscles and the membranes which make up the larynx. This is the atlas view of the larynx as a whole. The larynx is located in the anterior median plane of the neck. There is a hyoid bone which is present along the anterior median plane. As I have already mentioned, the entire larynx is made up of the cartilage, the membranes, ligaments and the muscles. We can see over here the upper portion of the larynx is in continuation opens up into the laryngopharynx through the laryngeal inlet, whereas the lower part of the larynx is in continuation with the trachea below. So above we can make out the cartilage. The one which is seen here is the leaf-like cartilage, the unpaired leaf-like cartilage which is called as the epiglottis, the thyroid cartilage which makes up the major contribution of the larynx, the signet ring-shaped cartilage which is called as the cricoid cartilage, below which comes the tracheal rings. So these are the three unpaired cartilages seen over here. Along the posterior aspect of the larynx, we can make out the paired cartilage which are smaller in size compared to that of the unpaired, the arytenoid cartilage which are conical in shape as observed here. Above the apex of the arytenoid cartilage lies the smaller cartilages which are called as the corniculate and the cuneiform cartilages. So the paired cartilages which has been mentioned is better visualized under the posterior view of the larynx. So this is the posterior view where we can make out the entire picture of the epiglottis which is leaf in pattern. The posterior borders of the thyroid cartilage is visible and the large lamina of the cricoid cartilage as seen from the posterior view. To begin with, we will look for in detail about the structures of the epiglottis. The epiglottis, as I have told, is the leaf-like cartilage which is unpaired present in the uppermost part of the larynx. This epiglottis has got two ends, that is the upper free end and the lower end. The upper free end is broader, whereas the lower end is narrow down, which reaches the posterior surface of the thyroid cartilage as seen over here. The major portion of this epiglottis is seen to hidden behind the body of the hyoid bone. So this epiglottis has got as the upper free end, it has got the narrow lower end, it has got the anterior surface as we can make out the upper half of the anterior surface. It has got the posterior surface which is seen over here, as well as it has got the two lateral borders. The lower end is in contact with the posterior surface of the thyroid cartilage through the ligament which is called as the thyroepiglottic ligament. The epiglottis is connected to the thyroid cartilage through its lower end through the ligament which is called as the thyroepiglottic ligament. So this is about the gross feature of the epiglottis. Moving on to the features of the thyroid cartilage. As we can see over here, the thyroid cartilage has got the two laminas on either side. Each lamina is in contact with each other through the midline angle which is called as the thyroid angle. The two laminas, the right and left laminas, the anterior border of each meet along the median plane to make up the thyroid angle. This thyroid angle is more angulated in case of males around 90 degrees, whereas in case of females and the younger children, the angulation is more obtuse which is around 120 degrees. So the difference in the angulation between the male and the female is responsible for the high pitched voice in case of females and children and low pitched voice in case of adult males. Each lamina has got the upper border, as we can note down here. It has got the lower border and it has got the free posterior border. The two surfaces, that is the anterior surface which is seen here and the posterior surface. Yes, it has got two borders, the upper, lower, two surfaces, anterior and the posterior behind. The posterior border is free and the upper and lower ends of the posterior borders make up the cornua, which is called as the superior cornu and the inferior corn. The superior cornu and the inferior corn, or the horns of the thyroid cartilage. Beneath the thyroid cartilage lies the cricoid cartilage, which is again unpaired. This cricoid cartilage is typically signet ring in shape with the narrow anterior arch in front and the broad posterior lamina behind. So the two parts of the cricoid cartilage is the narrow anterior arch and the broad posterior arch. The broad posterior lamina has got the anterior surface, posterior surface, the upper and the lower border. Along the upper border of this posterior lamina lies the arytenoid cartilage on either side, which makes up the joint, that is cricoarytenoid joint. So this is about the gross features of all the three unpaired cartilage, that is the epiglottis, the thyroid and the cricoid in total. When we talk about the paired cartilages, the paired cartilages, as I have told you, are the arytenoid, corniculate and the cuneiform. The arytenoid cartilage is conical in shape, where the base of the cartilage is in contact with the lamina of the cricoid cartilage, making up the cricoarytenoid joint. The apex of the arytenoid cartilage is in contact with the corniculate cartilage, which makes up the arytenocorniculate joint here, and the corniculate cartilage also lies closer to the cuneiform cartilage above it. So this is the location of the paired cartilage. The arytenoid cartilage represents two processes in addition, which are called as the muscular process and the vocal processes. Now this is the posterior view of the larynx, where we can make out the epiglottis very beautifully. Over here we can make out the posterior surface of the epiglottis, the upper free end of the epiglottis, which is broader, the lower narrow end, which is closer to the angle of the thyroid cartilage along its inner side, and the two lateral borders of the epiglottis. Regarding the structure of the cartilage which makes up the larynx, the entire larynx is made up of hyaline cartilage except the apex of the arytenoid cartilage, the corniculate, cuneiform and the epiglottis. Yes, these cartilages are elastic in nature. I repeat, the apex of the arytenoid cartilage, the apex of the arytenoid cartilage, the corniculate cartilage, the cuneiform cartilage and the epiglottis. So these are made up of elastic cartilage. Rest of the entire larynx is hyaline in nature. Rest of the entire cartilage is hyaline in nature. So this is about the gross features of the cartilages of the larynx. Next we will move on to the ligaments and membranes of the larynx over here. Moving on to the ligaments and membranes of the larynx, we always divide the ligaments and the membranes of the larynx into two categories, that is the extrinsic ligaments and the membranes and the intrinsic ligaments and the membrane. The extrinsic ligaments and the membranes, when we need to know, there are two membranes which are extrinsically present, which are externally present, and the three ligaments, and there are three ligaments which are present along the outer wall of the larynx. The two membranes are, as we can see here, the thyrohyoid membrane, number 1, and the second is the cricotracheal membrane. The cricotracheal membrane, which is present between the lower border of the cricoid cartilage and the first tracheal ring. So this is the cricotracheal membrane. Tracheal membrane. So these are the two extrinsic membranes which are present along the larynx. Number 1 is the thyrohyoid membrane. Number 2 is the cricotracheal membrane. Next, moving on to the ligaments, that is the extrinsic ligaments of the larynx. The extrinsic ligaments of the larynx are the median and the lateral thyrohyoid membrane, the cricothyroid ligament, and the cricotracheal ligament. I repeat, the three ligaments are number 1, the medial and the lateral thyrohyoid ligament. Number 2 is the cricothyroid ligament, and number 3 is the cricotracheal ligament. The medial and the lateral thyrohyoid ligament, the cricothyroid ligament, and the cricotracheal ligament. So these are the three extrinsic ligaments of the larynx. As we can see here, this thyrohyoid membrane, which is seen here, is thickened along its median plane and along its lateral borders, along its lateral portion, to make up the ligaments which are called the, so this is called as the median. This is called as the median, and on either side lies the lateral thyrohyoid ligament. Lateral thyrohyoid ligament. So these are the ligaments which are nothing more but the modified part of the thyrohyoid membrane. The next ligament, extrinsic ligament, is here, that is the cricothyroid ligament. Cricothyroid ligament. And the third is the cricotracheal ligament. The cricotracheal ligament, which is again present between the cricoid and the trachea, first ring of the trachea over here. So these are the three ligaments, extrinsic ligaments of the larynx. Moving on to the intrinsic ligaments and the membrane. The intrinsic ligaments and the membrane are again two. The two intrinsic ligaments include the vocal. The ligaments include the vocal ligament and the vestibular ligament. Vestibular ligament. Whereas the two intrinsic membranes include the quadrate membrane and the cricovocal membrane. Quadrate and the cricovocal membrane. So these are the two membranes. So the intrinsic two membranes are the quadrate and the cricovocal membrane, whereas the two intrinsic ligaments are the vocal and the vestibular ligament. So this is about the ligaments and the membranes in regard to the larynx. In this picture, we can make out the thyrohyoid membrane here, the cricothyroid ligament, which is seen here. We can see there is a deficit part of the thyrohyoid membrane. This thyrohyoid membrane allows the passage of the two structures, that is the internal laryngeal nerve, the internal laryngeal nerve, and the superior laryngeal vessels. Superior laryngeal vessels. So these are the structures which are pierced by the thyrohyoid membrane. The thyrohyoid membrane allows the passage of two structures, that is the internal laryngeal nerve and the superior laryngeal vessels. So this thyrohyoid membrane is modified, as I have already told, anteriorly, that is along the midline, to make up the median thyrohyoid ligament, and posteriorly makes up the lateral thyrohyoid ligaments. The attachment of this thyroid membrane below is over the upper surface, the upper border of the thyroid cartilage. Above, this membrane is seen to get attached over the upper border of the hyoid bone. Yes, the attachment of this thyroid membrane is over the upper border of this hyoid bone. So there is a space created between the body of the hyoid bone and the membrane, which makes up the subhyoid bursa. So that space makes up the subhyoid bursa. We can also make out the cricothyroid ligament extending from the arch, that is the anterior arch of the cricoid cartilage below to the lower border of the thyroid cartilage. So this is the sagittal section of the larynx, where we can again make out the thyroid membrane. We can make out the cricothyroid ligaments and the two processes, that is the muscular process and the vocal process of the arytenoid cartilage, is also very well appreciated. We can also make out the attachment of the connection between the epiglottis and the hyoid bone through the ligament, which is called as the hyoepiglottic ligament. So these are the framework how the cartilages are present, as I have already discussed, that thyroid cartilage having its two lamina, the cricoid cartilage which gives an appearance of the signet ring shape, the arytenoid cartilage which are cone in structure. So this is the picture showing the articulation of the cricoid cartilage with that of the arytenoid cartilage above. So this makes up the cricoarytenoid joint. This arytenoid joint makes up a joint with the corniculate cartilage above on either side. So the joints which are present along within the larynx are three in number. Number one is the cricothyroid joint, which is seen between the inferior horn of the thyroid cartilage and the posterior lamina of the cricoid cartilage. Number one. Number second is the cricoarytenoid joint, which is seen between the posterior lamina of the cricoid cartilage and the base of the arytenoid cartilage. Number third joint is the corniculate cartilage, which is seen between the corniculate cartilage and the arytenoid cartilage. So the joints which come under the larynx are three: the cricothyroid joint, the cricoarytenoid joint, and the arytenocorniculate joint. This is the diagram showing the sagittal section of the larynx, where we can very beautifully make out the intrinsic ligaments and the membranes of the larynx. As I have already discussed, there are two intrinsic ligaments and the two intrinsic membrane. The two membranes include the quadrangular membrane, which is also called as the quadrate membrane, and the second is the cricovocal membrane. The quadrate membrane and the cricovocal membrane, which faces along the cavity of the larynx. This, when we talk about the quadrate membrane, this quadrate membrane is seen to extend above from the lateral borders of the epiglottis, which is seen over here. Yes, above, the attachment of this quadrate membrane is over the lateral borders of the epiglottis. This quadrate membrane descends down to reach the inner surface of the epiglottis, inner surface of the thyroid cartilage, inner surface of the thyroid cartilage, which is seen over here. So it extends downward to reach the inner surface of the thyroid cartilage, where the lower border of this quadrate membrane is free. So the quadrate membrane has got the free lower border, and regarding the attachments of the quadrate membrane below, anteriorly, that is the anterior end of this quadrate membrane is seen to get attached over the posterior surface of the thyroid angle, whereas posteriorly the membrane is seen to get attached towards the muscular process of the arytenoid cartilage. So anteriorly it is taking attachment over the posterior surface of the thyroid cartilage, whereas posterior end of this quadrate membrane is attached to the arytenoid cartilage here. So this represents the free lower end of the quadrate membrane. The free lower end of this quadrate membrane is thickened to make up a ligament here which is named as the vestibular ligament. So the vestibular ligament, which is nothing but the one of the intrinsic ligaments of the larynx. This vestibular ligament is nothing but the lower thickened part of the quadrate membrane, which has got the attachment over the posterior surface of the thyroid cartilage anteriorly and the arytenoid cartilage posteriorly. So this is about the quadrate membrane and the ligament, vestibular ligament. So this is about the membrane and the ligament in the upper half of the larynx. When we talk about the intrinsic ligament or in the lower half of the larynx, again we have called the ligament which is called as the vocal ligament here, and the membrane, that is the cricovocal membrane. So the cricovocal membrane, which is one of the intrinsic membrane of the larynx, is taking its attachment below from the upper border of the cricoid cartilage over here. As you can see, this is the cricoid cartilage. The attachment of the cricovocal membrane is from the upper border of the cricoid cartilage, upper border of the anterior arch of the cricoid cartilage, which ascends upward to reach the inner surface of the thyroid cartilage again. Here in this case, that is in case of the cricovocal membrane, the upper end, that is the upper border of this membrane is free. The upper border of the cricovocal membrane is free and it receives attachment in its anterior and the posterior end. The upper free border of this cricovocal membrane is thickened to make up the ligament, that is the vocal ligament. Yes, the vocal ligament is nothing but the upper thickened part of the membrane, that is the cricovocal membrane. I repeat, the vocal ligament is nothing but the upper thickened part of the cricovocal membrane. In the same way, the vestibular ligament is nothing but the lower thickened border of the quadrate membrane from above. This vocal ligament has got the anterior attachment and the posterior attachment. Anteriorly, the vocal ligament is attached over the inner surface or the posterior surface of the angle of the thyroid cartilage, whereas posteriorly it receives its attachment onto the vocal process of the arytenoid cartilage. Vocal process of the arytenoid cartilage. So this is the vocal ligament. So this vocal ligament is covered by the fold of the mucous membrane, which is called as the vocal fold. The vocal ligament as well as the vestibular ligament, both the vocal ligament and the vestibular ligament, they are covered by the fold of the mucous membrane, which makes up the vocal fold and the vestibular fold. Vocal fold and the vestibular fold. So this vocal and the vestibular fold contain, so for example, the vocal fold contains the vocal ligament and the vocalis muscle along with it. So the vocal fold contains the vocal ligament and the vocalis muscle along with it, whereas the vestibular fold contains the vestibular ligament within it. So this is about the two intrinsic membranes and the intrinsic ligaments of the larynx, which is seen over here. Other than the intrinsic ligaments and the membrane, which is observed here, we can also make out the attachment, ligamentous attachment of the epiglottis over here. As I have already mentioned, the epiglottis, the anterior surface of the epiglottis is attached to the hyoid bone by the ligament which is called as the hyoepiglottic ligament. The posterior, the lower end of the epiglottis is attached to the posterior surface of the thyroid angle, make up the thyroepiglottic ligament. There is subhyoid bursa. This subhyoid bursa is a bursal space which is hidden behind the body of the hyoid bone and the thyroid, that is the thyrohyoid membrane. So this is the, we can also make out the arrangement of the cuneiform and the corniculate cartilage over here. So the entire quadrate membrane, as we can see here, this quadrate membrane laterally makes up the thickened fold which is called as the array epiglottic fold. Yes, the lateral border of this quadrate membrane is thickened to make up the fold, which is called as the, this lateral border makes up the fold, which is called as the array epiglottic fold. It is called as the array epiglottic fold. So here again we can make out the same structure, that is the vestibular ligament, the vocal ligament as I have discussed, the cricovocal membrane, the quadrangular membrane over here. We can also make out the vocalis muscle, which I have mentioned, which makes up the content of the vocal fold. This is the array epiglottic fold of mucous membrane. This array epiglottic fold mainly contains two muscles and two bones. Yes, the content of the array epiglottic fold, which is seen to extend from the lateral border of the epiglottis to the arytenoid cartilage, to the apex of the arytenoid cartilage over here, mainly contains two muscles. It contains mainly two muscles and two bones. Sorry, two cartilages. So the two muscles are here, that is the thyroepiglotticus and the aryepiglotticus muscle, and the two cartilage are the corniculate and the cuneiform cartilage, C and C. So the contents of the aryepiglottic fold, I repeat, are two muscles and two cartilages. The two muscles are thyroepiglotticus and aryepiglotticus, and two cartilages are the corniculate and the cuneiform cartilages, which make up the content of this fold over here. This is the diagram showing all the ligaments and the membranes as we have already discussed before, like the thyroid membrane, which allows the passage of the vessels and nerves as discussed. And we can also make out the other membranes like cricohyoid membrane, the cricothyroid ligaments, and the views, that is, this is the anterior view, this is the posterior view, and this is the lateral view of the larynx seen. Next, moving on to the attachments of the thyroid cartilage. As I have already mentioned, the thyroid cartilage has got the anterior surface, it has got the posterior surface of each lamina. When we talk about the attachments, yes, the inner surface of the angle, the attachments of the inner surface of the angle of the thyroid cartilage is important over here, as we can make out, that is, the inner surface of the angle of the thyroid cartilage gives attachment to the following structures from above downwards, that is, in the uppermost part of the inner surface of the angle, there is the attachment of the ligament, which is called as the thyroepiglottic ligament, below which lies the attachment of the vestibular ligament. Below the attachment of the vestibular ligament lies the attachment of the vocal ligament. On either side of the attachment of the vocal ligament lies the attachment of the muscle, that is the vocalis muscle, and most laterally lies the attachment of thyroarytenoid muscle. I repeat, the attachment of the posterior surface of the thyroid cartilage from above downwards, the attachments are: number one is the thyroepiglottic ligament, below which is the attachment of the vestibular ligament. Beneath the attachment of the vestibular ligament lies the vocal ligament. On either side of the vocal ligament lies the attachment of the muscle vocalis, and most laterally lies the thyroarytenoid muscle. So these are the attachments of the inner surface of the thyroid angle. When we move on to the attachments of the outer surface of each thyroid lamina, the outer surface of the thyroid lamina represents a ridge, which is called as the oblique ridge. Yes, this is called as the oblique ridge. Oblique ridge. The oblique ridge of each lamina also gives attachment to certain muscles, which are three in number. From anterior to posterior, the oblique ridge gives attachment to the muscle, that is the thyroid muscle, the sternothyroid muscle, and the inferior constrictor, that is the thyropharyngeal part of the inferior constrictor muscle. So these are the three muscles which are attached to the oblique ridge of the thyroid cartilage, that is the thyrohyoid, sternothyroid, and the thyropharyngeal part of the inferior constrictor muscle. So this is about the attachment of the oblique ridge of the lamina, which is present along the outer surface. Left is the attachments of the free posterior border of the thyroid cartilage. This free posterior border of the thyroid cartilage receives attachment of three muscles which is seen here, that is the palatopharyngeus, salpingopharyngeus, stylopharyngeus. Yes, the palatopharyngeus which is extending from the soft palate to the posterior border of the thyroid cartilage, the salpingopharyngeus which is a muscle extending from the eustachian tube to the pharynx, the stylopharyngeus from the styloid process to that of the posterior border of the lamina of the thyroid cartilage. So these are the three muscles, palatopharyngeus, salpingopharyngeus and stylopharyngeus, which are seen to get inserted as a conjoint tendon over the posterior border of the lamina of the thyroid cartilage. So these are the attachments of the thyroid cartilage. When we move on to the attachments of the cricoid cartilage, yes, the posterior surface of the cricoid cartilage, that is the posterior surface of the lamina of the cricoid cartilage gives attachment to the tendon of esophagus, that is esophageal tendon is attached to the median ridge over the cricoid cartilage. On either side of the median ridge there is the attachment of the muscle which is called as the cricoarytenoid muscle, attachment of cricoarytenoid muscle. So the posterior lamina of the cricoid cartilage gives attachment to two structures. One is the esophageal tendon and second is the posterior cricoarytenoid, the tendon of the esophagus and the posterior cricoarytenoid muscle. From the other attachments of the cricoid cartilage, as we can see here, there is a muscle attached which is called as the cricothyroid muscle, which is seen extending from the upper border of the cricoid cartilage extending upwards towards the thyroid cartilage, lower border of the thyroid cartilage. So this is the cricothyroid muscle. So these make up the attachment of the cricoid cartilage. So here is the atlas view where we can make out the attachments of the conjoint tendon of the three pharyngeal muscles, that is the stylopharyngeus, the salpingopharyngeus and the thyropharyngeal part of the inferior constrictor muscle, which is taking its attachment over the posterior border of the lamina of the thyroid cartilage, which is seen here. Other than that, we can also make out the membranes which are shaded in pink, that is the thyroid membrane, the other ligament like the cricothyroid ligament which is seen over here. So this is again the inner view of the lateral section showing the larynx, the picture of the epiglottis, very clean, very seen here, the ligaments of the epiglottis which is the thyroepiglottic ligament, the hyoepiglottic ligament which is mentioned here. This is the dissected view of the sagittal section of the interior of the larynx, where we can make out the muscles, the pharyngeal muscles along the pharyngeal wall, which gains its attachment over the lamina, the posterior free lamina of the thyroid cartilage, which is seen, the stylopharyngeus muscle, the palatopharyngeus muscle here, and the part of the inferior constrictor, which is seen over here. Here again, as I have already mentioned, the attachments of the muscles which is seen here, that is the thyroarytenoid muscle extending from the arytenoid cartilage to the inner surface of the thyroid cartilage, which is appreciated. I have already told about the epiglottic fold which is seen extending from the lateral border of the epiglottis, which is seen here, to the arytenoid cartilage. This epiglottic fold contains the muscle, that is the thyroarytenoid and the epiglotticus muscle. This is the picture where we can make out the structures piercing through the thyroid membrane. Yes, as I have told, the structures pierced by the thyroid membrane are two in number, that is the internal laryngeal nerve and the superior laryngeal vessels, which are piercing the membrane to reach the interior of the larynx. This is the picture showing the muscles which are the contents of the epiglottic fold. Moving on to the muscles of the larynx. The muscles of the larynx are studied under the two categories, that is the extrinsic group of muscles and the intrinsic group of muscles. The extrinsic and the intrinsic group of muscles. The extrinsic group of muscles are 5 in number. They are 5 in number. These extrinsic group of muscle, they attach the larynx to the surrounding structure, and the muscles, that is the extrinsic muscles, bring about the movement of the larynx as a whole. The 5 extrinsic muscles are the palatopharyngeus muscle, the stylopharyngeus muscle, the salpingopharyngeus muscle, the thyrohyoid, and the sternothyroid muscle. So these are the 5 extrinsic muscles of the larynx: the palatopharyngeus, the stylopharyngeus, salpingopharyngeus, the thyrohyoid, and the sternothyroid muscle. Among these 5 extrinsic muscles, all the muscles are involved in the elevation of the larynx. All the muscles are bringing up the elevation of the larynx. They mainly bring about the elevation of the larynx, except the sternothyroid muscle, which is involved in the depression of the larynx. The sternothyroid muscle depresses the larynx. It depresses the larynx. It is involved in the depression of the larynx. So this is about the muscles and their actions of the extrinsic group. When we move on to the intrinsic group of muscle, we categorize the intrinsic group of muscles based on their activity, based on their action. These intrinsic group of muscle are seen in between the adjoining laryngeal cartilages, and the intrinsic muscles are mainly involved in various movements of the vocal cord. The intrinsic group of muscle are categorized again, they are subdivided based on their actions mainly. They are categorized into 3 categories. The first is the muscles which bring about the opening and the closure of the laryngeal. The muscles which bring about the opening and closure of the laryngeal inlet. Laryngeal inlet. So there are 3 muscles which are involved in this open and closure of the laryngeal inlet. They are the oblique arytenoid muscle, the araepiglotticus muscle, and number 3rd is the thyroepiglotticus muscle. I repeat, the 3 muscles which are involved in the movements of the laryngeal inlet are the oblique arytenoid, the araepiglotticus, and the thyroepiglotticus. So we can just remember it as OAT. That is, O stands for the oblique arytenoid, A stands for araepiglotticus, and T stands for thyroarytenoid. So these 3 muscles mainly bring about the movements of the laryngeal inlet. Among these 3 muscles, the oblique arytenoid and the araepiglotticus muscle are involved in closure of the inlet. The closure, that is the laryngeal inlet, is closed by the action of these 2 muscles, that is the oblique arytenoid and the araepiglotticus, whereas the thyroepiglotticus muscle is involved in the opening of the laryngeal inlet. It is involved in the opening of the laryngeal inlet. So this is about the very first category, that is the muscles involved in the opening and closure of the laryngeal inlet. The second category of the muscle is the muscles that bring about the abduction and the adduction of the vocal cord. So these 3 muscles which bring about the adduction or abduction of the vocal cord are the posterior cricoarytenoid muscle, number 1, Next is the lateral cricoarytenoid muscle, and the third is the transverse arytenoid muscle. I repeat, the posterior cricoarytenoid, the lateral cricoarytenoid and the transverse arytenoid muscle bring about the adduction and abduction action of the vocal cord. Among these three muscles, it is the posterior cricoarytenoid. That is, the posterior cricoarytenoid muscle is the abductor of the vocal cord. The lateral cricoarytenoid and the transverse arytenoid muscle, these two are the adductors. These two are the adductors. So the posterior cricoarytenoid is very important, as this is the only muscle which is the abductor of the vocal cord. The only abductor of the larynx is the posterior cricoarytenoid muscle. This is about the second category. The third category of the muscle is the muscles which bring about the increase or decrease in the tension of the vocal cord, which maintains the tension of the vocal cord. These muscles are again three in number, that is the cricothyroid muscle, the vocalis, the cricothyroid, the vocalis and the thyroarytenoid. I repeat, cricothyroid muscle, the vocalis and the thyroarytenoid. Thyroarytenoid muscle maintain the tension of the vocal cord. The cricothyroid, vocalis and the thyroarytenoid maintain the tension of the vocal cord. So this is, which you can just remember, the muscles maintaining the tension of the vocal cord are CVT, which stands for cricothyroid, the vocalis and the thyroarytenoid muscle. So this is about the intrinsic muscles of the larynx. In total, intrinsic muscles are the intrinsic muscles are 9 in number. Out of these 9 intrinsic muscles, the first category of the muscles mainly bring about the opening or the closure of the laryngeal inlet, which include the oblique arytenoid, array epiglotticus and thyroepiglotticus. The second category of muscles are involved in the adduction or abduction of the vocal cord. These include posterior cricoarytenoid, the lateral cricoarytenoid and the transverse arytenoid. The one point to be highlighted is the abductor, that is the posterior cricoarytenoid, which is the abductor of the vocal cord. The third category are the muscles which maintain the tension of the vocal cord, or the muscles which increase or decrease the tension of the vocal cord include the cricothyroid muscle, the vocalis and the thyroarytenoid muscle. So this is about the intrinsic group of muscles, intrinsic group of laryngeal muscles. So this completes the muscles of the larynx. Among all the muscles of the larynx, the cricothyroid needs a special mention, as the cricothyroid is the only muscle of the larynx which lies on the external surface of the larynx. Yes, it is the only muscle, that is the cricothyroid is the only muscle which lies along the external surface of the larynx. The vocalis muscle is involved in the tension of the vocal cord. It tenses the vocal cords, whereas the cricothyroid also tenses the vocal cord. The thyroarytenoid relaxes the vocal cord. Hence, the thyroarytenoid muscle brings about relaxation of the vocal cord, whereas the rest two, that is the cricothyroid and the vocalis, tenses the vocal cord. So that's all about the muscles of the larynx. This is the atlas picture showing the muscle, that is the cricothyroid. As I have already mentioned, the cricothyroid muscle, which is the only muscle present along the external surface of the larynx, external surface of the larynx. So this is the cricothyroid muscle over here. We can also make out the part of the posterior cricoarytenoid muscle also. So this is the picture showing the intrinsic muscles of the larynx. As we can see, we can just look for the cricoarytenoid muscle, the lateral cricoarytenoid muscle, posterior cricoarytenoid muscle. Here is the thyroarytenoid, the thyroepiglotticus muscle, the oblique and the transverse arytenoid muscle. The posterior cricoarytenoid, as I have already mentioned, is the abductor. It is the abductor of the it is the only abductor of the larynx, and hence because of this action the posterior cricoarytenoid muscle is called as the safety muscle of the larynx. Yes, this posterior cricoarytenoid is called as the safety muscle of the larynx, as this is the only intrinsic muscle of the larynx which abducts the vocal cord and allow the entry of air through rima glottis in the respiratory tract below. So this is the superior view of the larynx showing the intrinsic muscle. We can just look for the vocalis muscle which is present along the lateral side of the vocal ligament. We can also make out the attachments of the inner surface of the thyroid angle. So the inner surface or the posterior surface of the thyroid angle receiving its attachment, that is the most medially lies the vocal ligament. Lateral to the vocal ligament is the attachment of the vocalis muscle. Lateral to the vocalis lies the muscle thyroarytenoid muscle. We can also look for the cricothyroid muscle extending from the cricoid cartilage to the lower border of the thyroid cartilage. The lateral cricoarytenoid muscle, this is the posterior cricoarytenoid, and of course the oblique and the transverse arytenoid muscle. All the intrinsic muscles, all the muscles of the larynx are paired except one, that is the transverse arytenoid. Yes, it is the transverse arytenoid. The transverse arytenoid is the only unpaired muscle of the larynx. So that's all about the muscles of the larynx. So in this video we have discussed about the cartilages of the larynx, the ligaments, membranes, muscles. We will look onto the nerve supply of the larynx, the blood supply of the larynx, and the clinical importance including the cavity of the larynx in our next video. Thank you.